Knock, knock. Hi, my name is Claire Inkstrom. I'm a student with Texas Women's University, and I am here to do some oral care on you. Do you think that you were able to clean your mouth yourself, sir? No? Alright, well, let's at least give it a try. And if you can't, then I will be able to do it for you. But first, can you give me your name and your date of birth? Alright, and do you have any allergies? Alright, gonna check it against the medication administration record. Alright, cool. We are good to go. So I'm going to provide oral care for this patient. So I've got the necessary supplies. I've got a toothpaste, toothbrush, of course. I've got a towel to make sure their clothing stays nice and safe. I have a basin for them to spit into, some water to rinse their mouth out, and I've got tissues to wipe their mouths off. All right, I'm going to go ahead and wash my hands. All right, and to promote independence, I'm going to go ahead and at least allow my patient to try doing their own oral care, but if he cannot, then I will be able to do it for him. All right, and I would put gloves on at this time as well. All right, sir, let me go ahead and do this for you for protection. All right, you can lean your mouth towards me. Perfect, awesome. All right, and I've got this by the bedside for you to spit into, and I've got some water for you to rinse your mouth out with. All right, so let me go ahead, take this out. All right, and I've got some toothpaste on here for you, sir. All right, you at least try. No. Yeah, you're having some weakness with your arm. Yeah, absolutely. Yeah, you said that you were having some weakness. That's all right. I can go ahead and do it for you. Is that all right with you? Perfect. Awesome. All right, so the way that I'm going to do this, obviously the bear doesn't have a mouth for me to reach into, but I'm going to go ahead and start from the back and clean on each side. All right, scrub, scrub, scrub. Make sure to get all around the teeth. Just kind of like I was brushing my own teeth. You know, you got to take care of your patients just as much as you would take care of yourself. Maybe even more, because some of us don't take very good care of ourselves, but we should. All right. So go ahead and scrub, scrub, scrub. All right, would you like some water, sir? All right, perfect. Give him some water. All right, close your mouth and rinse. Go ahead and spit that in there. Perfect. All right. And I'm gonna go ahead and scrub, scrub, scrub the other side. And I'm also gonna use this time kind of as an assessment. I can assess their mouth and their lips, just to make sure there's no fungal growth, which is something sad that can happen to a lot of patients if they don't receive proper oral care, which is why it's important to do it on them a few times a day, at least twice a day. All right, good kid. All right, you like to rinse? All right, and go ahead and spit. All right, perfect. Let's get the front of the mouth. And his lips look really good. They don't look dry, cracked. There's no signs of cyanosis or bleeding. His gums look light pink, which is a really good color. His teeth appear to be white. I don't see any signs of, no dentist, so I'm not a professional, but I don't see any signs of cavity or decay. And whenever I scrub his mouth, I'll be able to take a good look at his throat too. All right, you ready to rinse? All right, go ahead and rinse that out and spit. All right, and I'm going to take this time and I'm going to go ahead and put some more toothpaste on the toothbrush. All right, let me go ahead and wipe your mouth off. All right, halfway there. Perfect. Let's start at the back. All right. And I'm not going to try to make conversation with my patient like some dental hygienist do, because you know how awkward it is whenever you go to the dentist and they try to have a conversation with you with your mouth wide open, and it's just awkward. It's just awkward for everybody. So I don't do that to your patient. All right, you ready to rinse? Oh, cool, perfect. All right, go ahead and rinse your mouth out and spit. Perfect. Let me go ahead and go to the back. All right. His bottom teeth look really good too. Doesn't look like there's any signs of decay. Nice, scrub, scrub, scrub really, really well. All right. Perfect. You ready to rinse? All right. Go ahead and spit out. All right, go ahead and stick out your tongue for me. So I'm going to go ahead and brush his tongue off a little bit as well, just to make sure I'm not going to stick it back in his mouth or anything. to initiate the gag reflex, but it is good to at least get the tongue. So I'm going to scrub the tongue. All right, you okay, sir? All right. I'm going to scrub the top of the mouth as well. Perfect. And I'm assessing his throat and his tongue. His tongue, there doesn't appear to be any signs of cracking or fungus growth at all. His tonsils, I mean, I can tell a little bit in the light. I'd say 0. I can't even see them. So we're good. All right, so I need you to rinse extra well on this. Rinse at least for a few seconds, all right? All right, now I'm going to throw this all away. Of course, don't want to reuse any of that. All right, rinse, rinse, rinse. Okay, you can go ahead and spit it out. All right, do you want to rinse a second time just to make sure you got it? Okay, yeah, perfect. All right, rinse, rinse, rinse. Keep an eye on the patient. Make sure there's no aspiration. Perfect. All right, go ahead and spit. Perfect. If I had an unconscious patient, I'd make sure that they were leaning over on their side so there would be no risk of aspiration. So I'd lean them over on their side. And for this patient, I believe I forgot to mention it earlier, but I would also keep him in a high Fowler's position just to also prevent any risk of aspiration, water going into the back of his mouth. But obviously we don't really have that option here. All right, is there anything else I can do for you? All right, perfect. Well, I will be right back to give you a bath. I'm going to go ahead and put these supplies away.